Hi, everyone. Welcome to our third Facebook Live chat. And this is the first one that we are doing totally virtually. So I'm not even in the same room as Celeste here. So bear with us as we kind of get used to the new technology. Let me know if you can't hear us or anything, and continue to post questions live on the Facebook stream, and we'll get them as we'll answer them as we get them. Um, so let's dive right in. This is an amazing opportunity that we have to hear from Celeste the Therapist. She's a local Boston celebrity, I would say. She hosts a podcast and has just an incredible set of episodes about how you can empower yourself, your community, and shift your thinking to stay positive. This is something that I really wanted to get at today because in the midst of all we've been talking about with COVID-19, the economic impacts, the public health impacts, we go through a lot now of a new daily routine where you wash your hands whenever you can, you use hand sanitizer, you check in on everyone in your life, you're working, your kids are at home because schools are closed. But what we're not always talking about is how to take care of your mental health, take care of yourself, check in on your behavioral, social, emotional well-being. So that's why I'm excited that Celeste has joined us and that we'll answer your questions. So Celeste, can you just tell us a little bit about yourself? How did you get to where you are, and what do you do when we're not in the midst of a public health crisis?
Yeah, so hi, thank you guys so much for being here. I'm excited that you chose to do this because I think one of the things about what's happening now is that we have to be kind of creative with our choices and the things that need to happen. And it sounds like from what you're saying, you thought about people that might be struggling with mental health, and obviously there's no live support groups that you can create, but virtually is something that we can do. So I've been in the mental health field for over 15 years. I've always worked in nonprofit, so I spent 10 years working with the homeless population, Pine Street. This is actually the first time that I'm not inside of a placement where usually when these things happen, I would still have to be at work. So very familiar with the systems in Boston and the people on the front line. I appreciate you guys all. From nonprofit, I went into private practice. So since 2016, I've been in private practice, and recently, actually in January, I went virtual. So I've been doing telehealth full time since January. So I was kind of already ahead of what was happening. So it's worked out. Yeah.
Great. And tell us just a little bit about your podcast too. What made you decide to start doing that?
Yeah, so I have this podcast. Michelle Wu was a guest on it. A really great story. You guys got to check it out. So I started doing that because about 5 years ago, when I started, so I worked for a crisis team where I would be in the emergency rooms, and when I would talk to people and hear their stories and help them kind of navigate what their crisis was in the moment, I realized there's a lot of people that don't understand how to navigate crisis and kind of get stuck. So I decided to kind of go on social media and start having these authentic, transparent conversations about mental health. My goal has always been to normalize mental health. And so I was on Periscope and YouTube. I had a schedule Monday through Friday where I would do that very regularly. And 2018, I wanted to kind of branch out and create my own. And because I'm a therapist and I'm talking to people about how they can empower themselves, sometimes I think people think because I'm a therapist is the reason why I've been able to kind of have this mindset. And I stress to people that it's the work that I've been doing with myself and that there are other people doing the work. And so my goal had been to help people share other people's story, to give people kind of hope so that they won't feel that like they're alone.
And that's what we're hoping to do with some of these Facebook Live events too, is to kind of share as much information as possible, but also lift up voices of people who are doing incredible work. So just tell us from the perspective of someone who's seeing patients, you know, what is happening to folks now in the midst of this public health epidemic where we're asked to have social distancing, a lot of our usual routines are disrupted. How does that affect your mental health?
Yeah, I think because, sorry, one second. Let me just have my daughter turn down the TV. This is what's happening. Hold on.
Yep.
Princess, turn down the TV a little bit. So in regards to life changing, I guess I would like to start with like the kids first, since my daughter just kind of came. One thing that's happening is I think that our life has just been turned upside down without our permission and without any kind of real warning. And without any kind of clear and concise information, which is why you have people like Michelle and other people in the community trying to deliver information, because now the good thing about social media and the internet is that we can obtain information, but the hard part about it is that it's just all being thrown at you without any filters. So that can be challenging. And people that are parents with kids, not only is your life turned upside down, but your child's life has been turned upside down. And that's traumatic, right? That's scary. And I think that because we're getting stuck in the reality of the fact that it's scary, it's hard for us to really kind of think about, well, what can I do? I can't do this, but what can I have my kids do? So really being mindful of how it's affecting you and how you're coping with it, because our children are like right there watching the way we're coping, and they're picking up on our energy and they're picking up on the methods that we're utilizing. So really kind of being mindful on how it's affecting you and as it obtains to your child.
Yeah. And how do you manage that, either as a parent or what's your advice to your patients? Do you try to talk it out and make sure the kids know what's happening? Or, you know, my boys are 5 and 2 now, so they kind of get it. We've started the conversation about what this is, but they also sense, you know, we'll go out and all of a sudden they're not allowed to touch anything. They're not, you know, everything's dirty. And I worry about what this means also kind of for their long-term view of the world and trust in their environment. So what should I do with my kids, and what's your advice to everyone?
Yeah, so I mean, I have kids, just to put things into context. I have four kids, 17, 15, 7 and 8. My older 2 are special needs, one's autistic. So they all 4 required different type of communication styles. You know, I know there's a lot of parents who have children that are special needs as well, who may have been used to a routine. And so like my daughter the other day, she said, man, I wish this virus wasn't happening. And I think a lot of times, whether we're talking about the virus or something traumatic, a lot of times the norm has been to just kind of like, let's not talk about it. Let's just fill up their time with things to do so that they don't think about it. And maybe in the moment you may be too overwhelmed to answer that question, and you may try to distract them, which is fine. But I do encourage parents to give their children space to air out how they feel. Again, like as a parent, our frustrations are going to look different because we have bills, we have our jobs, we have so many other things to think about. So in our minds, it's like, well, they're kids, they'll be fine. And so unfortunately, sometimes the children kind of get dismissed. And, you know, I work with only adults, right? And so when I listen to the adult stories, they talk about these things that have come up in their lives that no one talked about. They remember this time period. It was traumatic. Nobody was sharing something, but things seemed chaotic. And those kind of things stuck with them and had an effect on them. And so this is one of those times where we can kind of change the narrative and really give kids an outlet so that they're able to express how they feel. They can write it out. You can say, you know, mommy's busy, daddy's busy right now, but you know, why don't you like draw about how you feel or write about how you feel? And then we can talk about it later, trying to create time where you have the space to talk about it, because you can't give anything if you don't have it to give. Does that make sense?
Yeah. And there's all sorts of layers of what you're trying to explain to them too. It's that mom and grandma and everyone who's taking care of you are maybe stressed about your health, right? The kids
Mhm.
and protecting you, but
Mhm.
also about the family finances, right?
Right,
With
right.
work now being stopped, not
Yeah,
being able to take the tea without worrying about if it'll come and if it'll
right.
be safe to do that. So how do you recommend people start to just sort out all the things that are stressors and how to process that, even just within yourself?
Yeah, so even just within yourself, it's a daily thing. A lot of the stresses that we have are the unknown. You know, we don't understand how this virus is going to work or when we're going to be able to get back to life. So we're really kind of taking it day by day. So one thing that I really encourage people to do is to create a schedule for yourself, whether you work from home or not. Trying to be intentional about your thoughts and what you're thinking. So finances is a big one, housing, my work, my family. Some people have a family that's not in the home with them, and trying to think about like what it is that I'm worried about. So let's just use family, for example, who's not in the home. Thinking about a plan, like how can I create space and time to connect with my family on the phone, on Zoom, and that way it's scheduled. If I have a grandparent or older person with with a compromised immune system, I'm worried about them because maybe they're not listening to me and they're going to church or they're going about
Right.
business as usual, and I'm fearful for them. And so we can't stop the older people from choosing to do what they are going to do, but we can't sit and stress about them. But what we can do, for instance, is we can talk to them about precautions when they come back. Make sure you're washing your hands. If you have a fever, whatever it is the doctor talks about as symptoms, kind of making them self-aware. So depending on the type of worry that we have, I think it's important to kind of look at it and say, what part of this do I have control over? Right.
Hmm.
And
Hmm.
a lot of us are controlled that are concerned about the virus getting into our home, whether or not we had to go to the store or not, or whatever. However, it happens. Right, that is a real concern. Like that's something that can really happen. But right now, I'm okay, and so I think it's important to try to be in the now, because if we're not in the now, that's a breeding ground for anxiety, to like worry about the future and what's going to happen. And I don't want to dismiss the fact that the future feels scary, but we're now. We don't know what's going to happen tomorrow. So trying to stay in the moment is going to be really huge during this time.
Yeah, and speaking of that, being in the moment, I mean, the part of the scary part is that not only do we not know maybe when this will be over or when slash if there will ever be a return to kind of quote unquote normal or what your routine was like before, but
Yeah.
even in the now, it's something that maybe we haven't had to um, experience in a while, right?
Yeah.
Trying to do your work and the kids and thinking about family and all that. How do you recommend kind of being intentional about the relationships with your family, your immediate family that you might now be spending a whole lot more time with?
Yeah, so I think one of the things that it's easy for us to not appreciate other moments. When people are not here, and they pass away, we think about things that we could have done. And so we have our family in front of us or with us now, and obviously when you haven't been in this close proximity to people, we're going to get on each other's nerves. My little ones, 7 and 8, they're every other minute there's something happening with them. And so what I would encourage you to do is work on resetting, right? So in the moment, they may have done something, and I'm like, overwhelmed, like, why are you guys screaming at each other? If I don't take a moment to reset and just like make it about that moment, I'm gonna make my whole day where I'm finding myself frustrated. And so whether we're talking about the kids, whether we're talking about work, whether we're talking about something we've seen blasted on the news, I think it's important for us to understand like what our body is how our body's responding, what we're thinking about, and working on asking yourself, what do I have control over, and kind of working on resetting in that moment. Does that make sense?
Yeah, so you kind of ran through a little bit of a checklist. I mean, do you have kind of digestible version. We're telling people now it's almost automatic. Wash your hands, keep 6 feet away from other people when you are there. Don't try not to touch surfaces or disinfect. What's kind of the equivalent for your mental health and relationships with people?
Yeah, so right now, because there's not a lot of options, I think being creative, like you're doing with this platform, with the things that you're going to do. For instance, for me, when I wake up, I literally write down what I'm going to do. And I also actually write it down for the kids and kind of post it on the refrigerator, just to give me some idea on what they're going to be doing, and it allows them to not have to like think about what's going to happen next. I think this idea of taking care of our mental health is something that unfortunately we haven't done really well. Like we've always been working and doing everything, and now we're kind of forced to. And so one thing I tell people is when you're trying to introduce something healthy, which we're talking about taking care of your mental health to your body may try to reject it because it's like a foreign thing. It's a foreign thing to be still and to acknowledge what's happening. So trying to wake up, be intentional about your day. A big thing that I really highly suggest for people to do is limit the time that you're spending on social media when it comes to the news and things that make you feel sad. And, a lot of times people will come back and say, well, I need to know what's going on. And I say, yeah, like I want you to know what's going on. But, there's like the CDC, there's the local government and state websites that don't really need your views. They're not trying to have clickbait for their specific sites because, with the media, they're not doctors. And so the thing that we're talking about, it's a medical thing. So I really think that when it comes to how am I caring for my mental health, being intentional about your day, what am I going to do today to take care of my mental health, right? So planning some time for you to be still and acknowledge like what you're feeling, what you're doing, and creating space to not be so engulfed in the news and what's happening, because it can definitely take over your body. Some ways to stay connected. There's virtual groups that are happening everywhere. That's the beauty of the internet, right? There's virtual groups. I've seen in Boston, Sheena Collier is doing a Friday night movie thing where everyone's watching a movie at the same time. So there's different things. I've seen the museum doing a virtual tour. And so if I wake up in the day and I set my day and I'm going to do this virtual tour at this time, I'm going to do this at that time, that can help ease some of the anxiety or the sadness that I have, because what ends up happening is we find ourselves replacing it with food or replacing it with alcohol. And like food is something that's very acceptable to our society, but it can become an addiction to try to stuff your feelings. Like alcohol you can stuff your emotions that way, and they're still there waiting for us on the other side.
Yeah. And as you mentioned groups, I want to shout out Luna, who's commenting and had said that what's helped her tremendously is joining community groups on Facebook, not only to stay up to date with info, but also folks are sharing links to things that kids can do online and offline. So I think now could be an interesting time, set aside a few minutes for yourself, part of the day, to just look at the new communities that are being formed, even if they're virtual, and which ones you want to try to tap into.
Yeah. And another big thing too is trying not to get stuck on what's not happening or what you can't do. Because there's a lot of routines and systems that people probably created for themselves that allowed them to have wellness, right? Whether it was going to your yoga or gym. The gym is a huge outlet for people. So those are some things that we don't have access to. And so try not to get stuck, like be sad. Let's mourn the loss of the fact that we can't go to these classes and can't do the things that we used to do. But let's think about like, what's the alternative and how can we do that, right? We know YouTube has a ton of different people that have these classes that you can kind of attend and do in the comfort of your own home. It's not the gym, but it's something different, right?
Yeah. And so on the flip side of that, we've been talking about being intentional setting the schedule and kind of aiming to live in the now and think about the things that are within your control, what are the warning signs that you might notice within yourself or maybe in your family members or others that you kind of really need to that it is affecting your mental health and you need to just take a breath, give yourself some space?
Yeah, so paying attention to your irritability is important. Everybody's on top of each other now, so there's not a lot of space in a lot of places. And so paying attention to that, paying attention to your body response. I had someone tell me the other day, my shoulders continue to go in and in, like I'm finding myself crunched over. Your body a lot of times will respond before logic happens, before you understand what's happening. Your body's already tensing up. And so unfortunately, we tend to work around the way it's tensing up and we just kind of start walking around like this. So kind of paying attention to that, paying attention to the way that your heart feels. If you feel like you're not getting enough breath, when people are having like a panic attack or anxiety, it feels really hard. When by the time the panic attack comes, there's little things that our body's doing to try to warn us. Not able to sleep or sleeping too much. That's something to pay attention to. So when it comes to the schedule, definitely try to work on creating a time where you go to bed at a decent time, even though you don't have to get up for work in the morning. It's helpful for your body because one of the things about our mental status that can get it completely off, which is within our control, is moving our body, what we're feeding our body, what we're putting into our body, and our sleep. And when those things are off, regardless of this pandemic or anything else, that can really throw us completely off and cause us to be irritable and snapping at everyone. So if you find yourself getting irritable and finding yourself snapping, it's okay to take a pause. It's okay to say, like, let me get 1 second. You don't have to be like super mom or super dad. You may have created a schedule for your kids and it didn't work out that way. Give yourself some grace because this is something different and new, and allow yourself to reset. I think that's important. So body responses, your behavior responses, what you're eating, how you're sleeping, and then, the liquor stores are still open. How often am I going to the liquor store? Have I increased my drinking that I'm doing, right? Because unfortunately, like with alcoholism, it doesn't start with somebody just being on the corner drinking every day. It starts with us not realizing that, hey, I think I might be just having this wine because I don't want to deal with what's happening. So just kind of paying attention to your behavior, and has it increased in some areas, and how do I feel after I do it? So those things are important.
And if you start to see that in people that you care about, what's the, how would you recommend someone kind of sensitively, at what point do you reach out? And I know folks are navigating a lot of that type of questions as well.
Yeah, so definitely without judgment. Sometimes people outside of us can see what's happening before we can, because we can be so caught up in it. Whoever the person is, just kind of reaching out and saying, if we're talking about, I noticed that, like you may notice somebody being more irritable with their kids, and hey, Celeste, like, how are you doing today? Like, how do you feel? Kind of starting off that way, and asking them, is there anything that they need? And if it's behaviors that are you're concerned that could be detrimental to the person or someone else, I think kind of calling it out and saying, hey, I noticed that you did X, Y, and Z, and it seemed kind of scary, what was that about? But kind of asking questions, not saying like, hey, you've been to the liquor store 3 times today. Are you an alcoholic? That's not helpful. To do something like that, but to say like, hey, how are you feeling today? And just kind of start there. A lot of times when we ask people how they're feeling, the natural response is to say fine. And I really think it's important for us to be like vulnerable, if not with other people, with ourselves, and just be honest about the fact that we may not be feeling fine today. Like it may not feel okay, and that's normal and that's okay. I think a big thing I really want to stress to people is that it's okay to say you're not okay. It's okay to take a breath. It's okay that you can't do everything. That's important to, I think, understand.
Absolutely. And I think we're all trying to figure out the ways in which we can have agency in this situation.
Yeah.
And it certainly hasn't helped that the baselines that we're used to about just knowing what the facts are has been difficult. Where there hasn't been widespread testing, and it introduces even that extra uncertainty about, well, it could be worse than I know. It probably is worse than I know. So I want to try to do my part to make sure that folks feel that reaching out to my team and me and suggesting questions that you have that we could explore or ideas that you have, we will always try to make sure to chase those down and either think about policies that could address that or lift up the situation. So if you're looking for a place to be heard, we are here, even if we're not there physically. And I love all your tips, Celeste. You talked about being in the now, creating a schedule, giving yourself the space and grace to be okay or not okay,
Yeah.
and thinking about the ways that your physical health and your mental health are linked, right? Your body,
Yes.
your feelings, your sleep, the food that you're eating.
Mhm.
Anything else that we're missing in terms of tips for self-care?
No, I think just the biggest thing is like you said, to kind of stay in the moment, because one thing that you just touched upon is this unknown, and the lack of even the some people that are in charge, like the CDC or the politicians, may not know certain things, and so and that's real, right? And so we can acknowledge the fact that we don't know what's happening. But one thing we have control over is the agency of our body. And I know this is new for some people, and you're kind of being thrown into being forced to have work on the agency of your body. But it's an important thing to do, because it's the one thing that like we do have control over. But it's important to like kind of shift your mindset around that area. Yeah.
Absolutely. So we will make sure to keep checking in with each other. And as we are further apart, we can still be together in other ways. So
Yes.
I'm going to thank you so much, Celeste, for what
Yes.
you do day in and day out and for making time to come on today.
Yes, thank you for having me. This is great. I really appreciate this. The homeless talk you had the other day, and the scientists, like all of those things are important. So thank you for this community.
Yeah, and tell folks, how can they get to your podcast if they want to
Oh
listen
yeah,
to
so my
episodes?
podcast, Celeste the Therapist, is streaming on all platforms. So you hear stories, you can hear Michelle's story, you hear stories from people that are empowering other people, and also I do these like 10, 15-minute bonus episodes where I kind of talk about issues we go through, and then I kind of think about solutions and ways we can deal with it. And the goal behind what I'm trying to do is just to help us kind of shift the way that we're thinking about things. So yeah, thank you.
So check it out, and then we will be back tomorrow, Thursday at 11:30. We'll be with Christine Coe, who is the founder and editor of the Boston Mamas blog. So speaking of our kids and ways to keep them happy and active, we'll have some tips there. And then Friday at noon with Ulrich Roberts, who is a local business owner, just to hear from him directly as a restaurant owner and chef, what has happened and what we could be doing to support that community. So thanks again, Celeste. Thank you, everyone.
Thank you, everybody. Okay, bye.
Bye.
Mommy. Hi, Mommy.